when I started working on this area that I've been working on here now for quite a long time ago, we looked at Luria, and Luria theorized that human cognitive functions can be described in terms of, he talked about 3 functional units, but basically 4 basic psychological processes. I encourage you to read this chapter that Tullio and I wrote for all the neurocognitive details. I'm going to tell you a little bit about it, but we don't have the time to go in it in much depth. But here's the big picture. So I'm using a simultaneous processing way of teaching right now. Simultaneous processing is about getting the big picture. And that's what we're doing. Planning, P-A-S-S. First is planning. This is thinking about how you do what you decide to do. That's like executive function. Frontal lobe. Attention is being alert and resisting distractions. Simultaneous processing, I already said, big picture, and successive processing is going to be required whenever you have to follow a sequence to do anything. Now, I want to draw your attention to something here. There's no psychobabble here. This is pretty straightforward. You can explain this to anybody. I've explained this to 8-year-old kids really easily. When I help them understand their strength, they're good at figuring out how to do things. But you really have trouble when you have to do something in order. For example, a true dyslexic child, actually. So it's important to recognize that what we have here is a very sophisticated theory based upon brain function, but it's easy to explain to people, especially parents, teachers, and most importantly, the students themselves. Because think of all the time when you have some kind of finding and you're trying to explain to a parent what it means. It's not always so easy. This is easy. And it's all about measuring what a person knows separately from what ways they think or may have trouble thinking. That's the distinction. So let's look at this just a little bit more closely, past theory. So I first started working on this in 1984. Here's a picture of my colleague and dear friend, J.P. Das. And we decided that we were going to reinvent concept of intelligence and its measurement. So in 1997, we published the first edition of Cognitive Assessment System. And then more recently in 2017, we published the second edition. And as you can see, we did age through those years. We both lost a lot of hair. And it's not an easy thing to do something really different, right? I mean, this is really different. And that's why it works so well. So I'm not going to go in to tell you all about it, just a few things. Traditional measure, like a 12 subtest version, a really short 20-minute version, a rating scale, and a Spanish edition. But they all get at the same thing: planning, and attention, simultaneous, and successive processing. So when we talk about planning, we talk about a neurocognitive function related to the frontal lobes, how we do what we decide to do. And I show you this little diagram on the right-hand side here. How would we actually measure it? Well, if you give a student a silly task like this, put XO under A and OO under B, kind of like coding on the whisk, right? But you say to them, after they know that these little codes go with these letters, you say you can fill it out any way you want. The student here did the XOs first, then the OOs, so the child organized the task, did the A's first, and then the B's next. That's a plan. And planning is needed for setting goals, making decisions, predicting the outcome of one's own and others' actions. Very important. Prediction, what should I do? What might somebody else do? Impulse control, strategy generation, and retrieval of knowledge. Sometimes the best plan is to get more information. Anyway, next, attention is really very straightforward. It's all about selectively attending to some stimuli and ignoring others. So we say focused cognitive activity with resistance to distraction and selective attention. And the Stroop test is a good example of that. Because when you look at the word red here, you want to say red, but you got to say blue. And that's what makes it such a good measure of attention. And of course, successive processing. This is all about sequencing. So planning for the front part of the brain, attention for the base of the brain, and successive processing for temporal parts of the brain. This is where decoding words, letter sound correspondence, phonological tasks, understanding syntax. This is where all this happens. Now, this is what dyslexic children look like. They can't do this. They can't work with information. And we often think, oh, they're dyslexic because they can't do phonological tasks. No, that's not it. The phonological task is a symptom. Successive processing is the foundation of the phonological tasks. And you can find more about that on my website. Look at any of the papers I've done with Steve Pfeiffer. Also, simultaneous processing, I already mentioned, is about getting the big picture. Like a progressive matrix is a really good example, but so is reading comprehension or whole language. When you have to see how things go together, you could think of it as visual spatial, but it's not just visual, and it's not just visual either. It could also be verbal. We have a verbal spatial relation subtest on the cat. One fine point here, one thing to consider. We often talk about tests on the basis of their modality, visual or auditory. I was taught this in the 70s. Unfortunately, the research on the effectiveness of teaching by modality is pretty bad. Why doesn't it work? Because it's not about modality. Because the way the brain works is they have these heteromodal association cortex. That means once the information gets in, it goes to these parts of the brain where whether or not it's visual or auditory or kinesthetic or whatever, that doesn't matter anymore. It's really not about the modality. It's not about the content either. So you can have a verbal simultaneous test and a nonverbal simultaneous test. You could have a visual successive test and an auditory successive test and so on, because it's the level of processing is deeper than the modality.